Hello everyone. Today, we're diving into the world of a medication called Cabazitaxel, commonly known by its brand name, Jevtana. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Cabazitaxel, marketed under the brand name Jevtana, is a chemotherapy medication used to treat prostate cancer. Specifically, it's prescribed for men with metastatic castration-resistant prostate cancer, mCRPC, that has progressed despite treatment with docetaxel. Cabazitaxel works by inhibiting cell division, effectively targeting cancer cells and slowing their growth and spread. Administered intravenously, Jevtana is typically given in combination with prednisone. The FDA approved Cabazitaxel in 2010, marking it as a critical option for patients who have limited responses to other treatments. Warnings: Cabazitaxel comes with significant warnings and precautions. One of the primary concerns is the risk of severe neutropenia, a condition characterized by dangerously low levels of neutrophils, a type of white blood cell crucial for fighting infections. Patients undergoing treatment with Jevtana should be closely monitored for signs of infection. Additionally, Cabazitaxel can cause severe hypersensitivity reactions, including anaphylaxis. It is not recommended for patients with a history of severe allergic reactions to Cabazitaxel or other drugs formulated with polysorbate 80. Before taking this medicine. Before starting Cabazitaxel, several factors need consideration. It's essential to inform your healthcare provider if you have a history of allergies, especially to medications containing polysorbate 80. Given its impact on blood cells and immune function, those with pre-existing conditions such as neutropenia or other blood disorders should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider as Cabazitaxel can harm an unborn baby. Regular monitoring of blood counts and liver function is advised for those undergoing treatment with Jevtana. You should not take Cabazitaxel if you have severe liver impairment or if you have a history of severe hypersensitivity reactions to this medication or other drugs formulated with polysorbate 80. It's also not recommended for individuals with neutropenia at the start of the treatment cycle. Before starting the medication, inform your doctor if you have ever had kidney problems, liver problems, heart problems, or a history of allergic reactions. It's also essential to let your healthcare provider know if you are taking any other medications, including over-the-counter drugs and supplements, as these could interact with Cabazitaxel. Side effects: All medications can have side effects, and Cabazitaxel is no exception. Some individuals might experience side effects such as anemia, fatigue, nausea, vomiting, diarrhea, and loss of appetite. Hair loss and peripheral neuropathy, a condition causing tingling or numbness in the hands and feet, are also common. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Severe side effects include febrile neutropenia, fever with low white blood cell count, severe diarrhea, and severe hypersensitivity reactions. Signs of severe allergic reactions may include rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, and trouble breathing. There is also a risk of severe gastrointestinal symptoms such as stomach/abdominal pain, black/tarry stools, or vomiting that looks like coffee grounds, which could indicate bleeding. Another potential serious side effect is interstitial pneumonia, an inflammation of the lung tissue. If you notice any signs of infection, severe diarrhea, unusual bleeding, or breathing difficulties, seek medical attention immediately. Interactions: Cabazitaxel might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Medications that might increase the risk of side effects or alter the effectiveness of Cabazitaxel include blood thinners, certain antibiotics, antifungals, and antiepileptic drugs. Dosage: Correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Cabazitaxel. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended dose of Cabazitaxel for most patients is 25 mg per square meter administered as a 1-hour intravenous infusion every 3 weeks in combination with prednisone 10 mg administered orally daily throughout treatment. It's important to follow your healthcare provider's instructions carefully and not to alter your dosage without consulting them. Avoid While on Cabazitaxel, it's advisable to avoid exposure to infections due to the increased risk of neutropenia. Given the potential for dizziness and weakness, it's wise to rise slowly from sitting or lying positions. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects and interact negatively with the drug. FAQ. Many wonder about the age restrictions for Cabazitaxel. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Cabazitaxel. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.